Thank you. Thank you, Alicia, for inviting me to be here today, and thank you to all of you for coming today. I acknowledge the difficult journey that you have each been on, and I thank you sincerely for helping to educate healthcare providers about Lyme/MSIDS by describing your symptoms accurately, reporting what you have tried, what works, what didn't work, what you have an interest in trying, what you don't have an interest in trying. I've observed that over time that many changes in healthcare come about as a result of people explaining to their healthcare providers what works for them and asking questions about things that the healthcare provider doesn't know so much about. And as I was reading up a little bit and preparing for this talk, I came across this quote that struck me, and maybe all of you have heard it or seen it. It's a quote from the late Ed Masters, who's discoverer of Starry, a Lyme-like illness, and it's from the book Bullseye on the History of Lyme Disease by Jonathan Edlow, Professor of Medicine at Harvard Medical School. And he says, Masters points out that the track record of the conventional wisdom regarding Lyme disease is not very good. First off, they said it was a new disease, which it isn't. Then it was thought to be viral, but it isn't. Then it was thought that seronegativity didn't exist, which it does. They thought it was easily treated by short courses of antibiotics, which sometimes it isn't. Then it was only the Ixodes domini tick, which we now know is not even a separate valid tick species. If you look throughout the history, almost every time a major dogmatic statement has been made about what we know about this disease, it was subsequently proven wrong or underwent major modifications. Now, does that strike you as part of what you've experienced? We think we know and we don't. I enjoy public speaking. I don't do it very often. And today I'm going to pretend that I'm talking to just one of you in my office, and that will help keep me at ease. And I'd like to answer these questions. What is chiropractic? How does chiropractic relate to Lyme/MSIDS? When should I see a chiropractor? And of course, self-help techniques. And after we answer these three questions, do you sometimes take a little break or keep going? Okay, then we'll be doing the self-help techniques will be very interactive. So talk about what is chiropractic. How many here have not been to a chiropractor? Thank you. I find it's helpful to understand the vocabulary of a certain area of study. The word chiropractor comes from the Greek base of chiro, which is hand. Practor means to do. So it's something that's done by hand, typically done by hand. Chiropractic is the practice, and some people think, well, is it chiropractic, sort of like podiatry? It's chiropractic. A chiropractor goes to school to receive a DC degree, Doctor of Chiropractic. We are especially concerned with the health of the spine, including the vertebrae. Vertebrae is plural, vertebrae is singular. The cervical vertebrae is the neck portion of the spine. There are 7. The thoracic vertebrae is the rib cage part of the spine. There are 12. And the lumbar vertebrae are the lower back. There are 5. Then there's the sacrum, the large one at the base of the spine, and the coccyx, the tailbone. We're especially concerned about spinal subluxations. And if someone asked you to define a spinal subluxation, would you have something right on the tip of your tongue?
Yeah, it's means you need an adjustment.
That's a good response. And I'm going to give B.J. Palmer, the developer of chiropractic, I'm going to give his definition of a spinal subluxation. Some think that one of the rifts between chiropractors and medical doctors stems from the fact that we use this term that medical doctors don't learn in their studies, and so they don't know quite what to do with it. A subluxation has three parts. One is that a vertebra is out of its normal position. And when I say out of its normal position, the word luxation refers to dislocation. Sub means less than. So a subluxation is a misalignment that's less than a dislocation. And in fact, sometimes the term subluxation is used in medical terminology. If you ever read an x-ray report and it says it doesn't show any subluxations, they're typically referring to dislocations. But from a chiropractic point of view, a subluxation can be as little as 3/4 of a millimeter. And a millimeter is about that much, so it's very subtle. The effects of it can be not so subtle. It's a misaligned vertebra that occludes or changes the shape of an opening through which nerves pass, and also affects the function of the nerves. And all of those three things have to be present to be considered a spinal subluxation. The job of a chiropractor is to determine if a person has a spinal subluxation or not. If you went to a chiropractic office and the chiropractic did an evaluation and found that you did not have a spinal subluxation, then we would know that you're not a chiropractic case. It's like if you went to a dentist and the dentist did or didn't find cavities. If the dentist found cavities, the dentist would say, we're going to take care of this, regardless of whether you were experiencing symptoms from those cavities or not. As you said, the treatment for a spinal subluxation is a chiropractic adjustment. And many different ways have been developed to correct spinal subluxations. And there are currently well over 100 different chiropractic techniques used to correct spinal subluxations. And most people know that there are more than one, but most people don't know that there are quite that many. And of those 100 techniques, about half of them use a more forceful type of adjustment, and about half of them use a lighter force adjustment. And I have to say that I'm glad that there's a variety of techniques available, because some people feel like they just haven't gotten their money's worth unless they felt that crack and heard that snap. And others find that they would prefer to have a lighter force approach. Of those 100 techniques, about 5 or 6 of them pay very close attention to the alignment of the upper part of the spine, the upper cervical area. And those techniques are called the specific upper cervical techniques. The reason that that part of the spine is important is that 90% of the nerves that go from the brain to the rest of the body go through that area, and also the nerves that control the blood supply and the nerve supply to all of the structures in the skull are affected by that area. And so it is a specialty within the chiropractic profession. It's the far light end of light force techniques. It does require additional training, and it's a difficult technique to learn and to apply. And so therefore only 0.5% of chiropractors use this technique. They're currently working in research to make this technique easier to learn and easier to apply, and they're succeeding in that, and therefore more chiropractors are studying it. I'm also happy to report that there's a trend in the chiropractic profession towards more chiropractors using the lighter force techniques. I feel that's a positive trend. If something can be corrected by being more specific and therefore requiring less force, that makes sense to me. For those who haven't been to a chiropractic office, I'd like to just explain briefly what a first visit would be like. First, there's a thorough history with an emphasis on thorough, an exam and screening. The screening is to determine if a person has a spinal subluxation. And if you remember about the definition, there has to be an effect to the function of the nerve system to be considered a subluxation. Research shows that at any given time, about 50% of adults are out of alignment. And those other 50%, I hope they're thankful that is the case. And throughout one's lifetime, they found that about 80% of people will experience spinal subluxation and or back or neck pain in their lifetime. And again, the other 20%, they're very fortunate. So if the screening indicates that a person has a spinal subluxation, then the next step is spinal alignment X-ray views. Not all techniques use spinal X-rays. Those that do, the X-rays are typically done in an in an upright position, whereas spinal X-rays in a medical facility are often done laying down. And we want to see the effects of gravity on the spine. And so while medical X-rays are useful, typically there needs to be done some weight-bearing X-rays as well. There are also technique-specific X-rays for specific upper cervical that are used to make very detailed calculations so that the angle of the adjustment can be calculated with great precision. Then the chiropractor would give a report of findings, the results of the exam and X-rays, and recommend a treatment plan which would also include specific self-help instructions. Often from the examination and X-rays, we can determine what specific things would be most useful for that particular person. And I don't know about you, but if I learn that something is just the right thing that I should be doing, I feel more inspired to do it and work with it, as opposed to something I might read in a report or read in a book. I'm more inclined to do it if I know it's a specific recommendation for me. The chiropractic adjustment, in the specific upper cervical technique, I call the adjustment quite a disappointment. It's very light force. People laugh after you give them the adjustment. You can say that, Marianne. And they say, how could that do anything? Did you really touch me? And the history of this technique is that it was developed by a chiropractor who was an engineer before he became a chiropractor. And he used the principles of engineering and physics to be able to make the adjustment very, very specific. But he started with using the more traditional forceful adjustment. But as he was able to make the adjustment more and more specific, he found that he could accomplish the correction using less and less force. So the light force part is a side effect or side benefit of the specificity. And then after the chiropractic adjustment, then brief tests are done afterwards to determine if the adjustment was successful in reducing the nerve pressure. Well, I got through that part a lot faster than I thought. So I'm going to tell just a little bit about my family's experience with Lyme. In 1996, we noticed a red mark, a red rash on the back of my husband's calf. And even though knowing that his family has a hunting shack, a deer hunting shack in northwestern Wisconsin, we had studied up on Lyme disease, knowing that that was an epicenter at that time. We had pictures of the ticks posted on the bulletin board at the hunting shack. We had articles about Lyme on the bulletin board. A close friend who's a physician here at the UW also hunts in that same area. He had done a lot of study about Lyme. And so we looked at my husband's calf and we said, I wonder what that is. That's weird. The physician looked at it and said, boy, I've never seen anything like that before. It wasn't a bullseye, it was just about this long and this wide, and it was really bright red. And I had just gotten back from a trip to Africa, climbing Mount Kilimanjaro and rafting the Zambezi. And the best we could come up with was, well, maybe there was something weird that came back in my luggage that did it. So the next summer, and he did have fatigue, but he didn't have flu-like symptoms. And so the next summer he was experiencing swelling of his hands, and it got to the point where he couldn't hold his golf club. So that was serious. So you know how it is. How long before your husband went to see someone?
We had so many arguments trying to get him seen. Yeah, I'm fine.
So thankfully he had been quite healthy throughout his life and hadn't had many times that he had needed to see a primary care provider. And so he went to see a primary care provider in Sun Prairie. We live in Sun Prairie, and described his symptoms and asked if he could be tested for Lyme disease. And the provider scoffed and said, "What makes you think you have Lyme?" And but fortunately, he did order the test, and fortunately, it did come back positive. And so the provider prescribed 1 week of doxycycline. No, I'm sorry, 2 weeks. 2 weeks of doxycycline. And at least we had read enough about it to know that that probably wasn't going to do it. And so, given the response that he had had from the primary care provider, he chose to tell a lie. And he said, "Well, I was out of town. I left my pills where I was. Could you give me another prescription?" And he did. And so another 2-week prescription. And at the end of 30 days of the medication, he was feeling some improvement, but knew that he was going to need more than that. And so then he called our friend, the physician, and asked him if he would prescribe additional antibiotics, which he did. And so I believe my husband was on the doxycycline for 2 or 3 months. And again, he was very fortunate. It did seem to resolve his symptoms. Since that time, there have been about 2 or 3 times when he has had recurrence of symptoms, felt the need to take an additional course of antibiotics, called his friend was compliant, and he found that he responded. The long-term effect that he has had is acceleration of arthritis in his knees. I understand knees are one of the places that the Lyme organism tends to settle, and so that has been his long-term effect. And so to compare his response, or the response that he received in '96 to current, last fall, my sister-in-law developed large, thin red circles all over her body. Did anyone have that symptom? I had not seen it before. It wasn't a bullseye, it was just a real thin red circle, and the whole inside was white. And it was the strangest thing. And
Yeah, I think I had that, but it was like in 1989.
it's called erythema migrans.
Yeah,
And
nothing in the middle.
pardon?
There was nothing in the middle.
Right, right. And so we all looked at it and said, "Gee, we don't know what that is." And so she made an appointment to see a physician's assistant. And by the time she got there, that symptom had cleared up. And she said, "Well, I don't know why I'm really here. I just had the appointment. I thought I'd keep the appointment." And luckily, the physician's assistant was up to date on Lyme. She knew exactly what it was, and started her on antibiotics right away based on that symptom. And then we did look in our Merck's manual. There it was, the picture of that very, very thing, saying it's a sign of Lyme. And so then she looked back and thought, well, I wondered why I had felt so tired over the summer. I thought I was just, doing more things than usual, and thankfully she's had a good response. And then her husband, my husband's brother, was feeling a great deal of fatigue this past fall, and went in. He was tested. Thankfully, the test came back positive. He was treated, and he's had good results. About 10 years ago, my brother he lives in San Diego, and he was on vacation in Wisconsin, and he's the weirdest guy. He likes to chop wood. So on his vacation, he chops wood out in the woods. And maybe a week or so later, he developed severe and excruciating sciatic pain. And have any of you had that symptom as part of the Lyme? And it was, I mean, we as chiropractors treat sciatica regularly, and this was just a lot worse than what's typical sciatica. So he went to urgent care, and they treated him the way they would typically treat sciatica, with muscle relaxants and anti-inflammatories, which of course didn't make any difference. And so then when he went back to San Diego, finally my husband and I were kind of thinking, well, we encouraged him to request a test for Lyme, and he did, and it came back positive, so he was treated and responded to the treatment very thankfully. And so that was about 10 years ago, and also about 10 years ago when we came back from the hunting cabin, we had been up there for 4th of July, and we do all of the tick prevention things. We spray our shoes with permethrin, and we wear slippery pants and tuck them into our socks, and avoid the damp areas, and we do tick checks every night. But when we got back, I found it was a deer tick attached around my waistline, and so I called some of the urgent care centers in this area, asking if, again, this was 10 years ago, asking if they did preventative treatment for people who have deer ticks attached. And some said they didn't, some said they did, so I went to the one that said that they did, and they, you know, you have to find a physician who thinks like you do, and then work together. I found that you really can't have a physician that thinks differently than you do and try to convince him or her to do something different. So that was my technique. And so at urgent care, they did prescribe a dose of doxycycline. It was just one dose. And I did not get Lyme. Who knows whether I was infected or not, but that was my own experience. We've been very fortunate in our family to have had positive outcomes. How does chiropractic relate to Lyme? I'm thinking of three things that come to my mind. I've had the opportunity to work with quite a number of people who have a diagnosis of Lyme, and I'm very thankful for their willingness to educate me about their experience. From my point of view, one of the reasons Lyme is so complicated is that each person responds to a different combination of things. What works perfectly fine for one person doesn't do a thing for the next person, and vice versa. If the same thing worked for each case, it would be a very simple condition. You have this, we do this, but that is not the case. And so from a chiropractic point of view, my understanding is that the Lyme organism will tend to settle in an area of weakness. And so if a person has a spinal subluxation, that then is an area of weakness and would be easier, and then therefore it's easier for the Lyme bacteria, spirochete bacteria, to settle in that area. Another point is that the nerve system controls all systems of the body. The nerve system consists of the brain, the spinal cord, and the peripheral nerves. It's the first system that develops in a fetus, baby, as they're developing, and it controls the development of all of the other systems, as well as the function of all of the other systems, including the immune system, the digestive system, the respiratory system, the reproductive system, the urinary system, the musculoskeletal system, the sensory organs, the lymph system, the cardiovascular system. And so because the nerve system controls everything else, if there's something that's affecting the function of the nerve system and the nerve system is not functioning at 100% of its capability, then there's going to be a resulting lesser than 100% function of whatever system the nerves are being affected is affecting. And so by assuring that the nerve system is functioning at 100% of its capability by correcting any spinal subluxations, then it allows the body to function at a higher degree of capability and has a better ability to cope with the effects of a chronic condition, as well as trying to having just a little bit easier time to get ahead of it. A third reason that I can think of that chiropractic can be helpful for people with Lyme is pain. Lyme involves pain. And if that pain is related to the spine, then correcting the spinal alignment and removing the physical pressure of that's being placed on the nerve by that spinal subluxation is, many people say they feel much better after, many people with Lyme say that they feel much better after the adjustment. And I'm going to say too that I'll add a fourth thing. If the spine is out of alignment, affecting the function of the nerve system, it's one more thing that the body has to cope with. I've tried and tried and tried, but I just can't think of any benefit of having a spinal subluxation. Maybe there could be a benefit of getting punched in the nose, but I just can't think of any benefit of having a spinal subluxation. And so when that is present, then that uses up a lot of the body's energy and effort to have to cope with the spinal subluxation as well as the effects of it. So if a person has subluxations and they're corrected, then that energy and effort is freed up to go to whatever else the body is working on at the time, particularly chronic disease. So before we go to the self-help techniques, does anyone have any questions about what we've talked about so far?
I just had a question about your husband, I think your brother-in-law and your sister-in-law. They were all tested for Lyme and they had it and they were treated. What test did they use? Because usually I was tested like 4 times and it was always negative because they, you know, they stuck with the LISA, the garbage test we call it. But you must have talked your doctor into using a Western blot panel.
That they all had the Western blot panel.
Interesting.
That's very interesting because nobody else has been able to do that. They refuse to do it.
Your family is loved.
They liked you a lot.
I know, and that's why I feel like we're so fortunate that that's the test they had.
Yeah, but my understanding, standard Western blot is not that effective and is wrong 30–40% of the time. And the only one that is really accurate or has some sense of accuracy is the one out of Isom lab in Palo Alto, California, and they don't use that lab.
But the Western blot's better than the ELISA.
Yeah, it is, but
a little.
Well, I think in my brother's case, being that he's from San Diego and that's not all that far from Palo Alto, I think the clinic that he was at, that's where they sent the test to be interpreted, or where they had the test done. So I think they were probably a little more knowledgeable than maybe in some other areas. And we were just plain lucky that it showed up on the Western blot test in each of those cases, because I know is at least 25% of cases or more, it doesn't show up on that test.
well,
I
the
think
Western
it's
blot
more.
that they use, 30–40% of the people think they have it and they don't, and truth is the opposite. And so people, it's a very misleading test for what 95% of the medical community uses. And to get them to use the hygienics test out of Palo Alto, they won't do it. They won't use it.
Not so much a question, just I wanted to tell you an experience that our family had. My son, who was 17 at the time, he's finishing, we've homeschooled all of our kids. He is doing college work with high school kind of a thing. And so it's pretty demanding, and he just had gotten used to having chronic headaches, and he never even told me about them. But one day I think I was griping at him about something, and he said, "I just can't concentrate, Ma." something hurts or whatever, and it was like, bing, you know, it's like, typical guy, they won't tell you anything, and finally you find it out, and so I think I'd been seeing you, and I said, well, I'm gonna sign you up too, you're going. Within a second of her, and she's gonna describe what she does of adjusting this atlas bone, which is the bone that surrounds your spinal column. He had instant relief, and he hasn't had a headache since. Isn't that amazing? A 17-year-old kid in perfect health. And then at MMA, something happened, and his rib didn't dislocate, but she said it was a pretty severe subluxation, and the kid was in tears. I mean, I've never seen him such in pain. And that one took maybe 3 times to kind of adjust, but it made all the difference. Same thing with something in his wrist. Just bizarre little things, and I just wanted to add that you might not feel out of whack. Like, I've always had a hip issue ever since babies. And the adjustment up here helps this down here. So you might be struggling with something in your knee or your ankle, and by getting this adjusted, and she's going to explain this, the body compensates all the way down and fixes itself. It's amazing. So keep that in mind. You know, you might not feel anything in your neck or head, but you might have pain somewhere else. And this here could help that.
I'll attest to that. She told me that I was a very difficult case. And
Well, we all know
she
that.
just works at it. She just works at it and works at it. And I mean, it's not like I gotta go there every day so she can work at that, but you know, she just studies the body. She'll study individuals, and she's learned how I work, and from that she can see the difference between my fibromyalgia and my Lyme, and we've discussed that. I've had both, and she can tell the difference, the way I react, the way I react to the adjustment, what kind of mood I'm in when I come in. But, and I'm learning that now. I can tell the difference, the differences. And just if I just need an adjustment, period, and it's not nothing else. It's really something.
Thank you.
And there is another thing. Oh,
No, go ahead.
I wanted to change the subject to the testing. Now, I had 4 or 5 different tests, probably in the last 12 years, and they were all negative. This last one came back with rings or the bands, and that's how my nurse practitioner thought, you've got Lyme and it's not showing up anywhere. So she sent me someplace, she didn't send me, she takes the Lyme test and sends it to just up north by Wapaka maybe? I don't know, I just read the article, just someplace here in Wisconsin, central Wisconsin. And it's called the eye spot, okay? And I just read an article on the internet, I don't know if it came from you, from the doctor in Green Bay who discovered this eye spot test. And he says that this test is different in the way they can track the progress of Lyme. They can tell if it's helping or not. So these other tests that you have evidently are not able to do that. But this eye spot is. So this is interesting because they can track the T cells, and that's how they can tell that from this test. So I think that's interesting. Is that what you had?
No, I had IGenics and it came back very positive, as they put
Okay.
in the Lyme doctor, the most positive one they've seen. so
Who's
so it was
your Lyme
good.
then? Who's your Lyme then?
Well, the one that I won't say at the time because of what I said before, but I can talk to you before. But
You don't want to mention his name?
She'll tell you
yeah,
afterward.
I'll tell you
She'll whisper it in your
later. I
ear.
don't want it on the table. But anyway, yeah, so I do have the IGenics. It's a positive. But the Lyme Summit that's running right now, that doctor was interviewed yesterday talking about the eye spot and that this is a whole different methodology. And like you said, it's not only to show whether you have it, but also to be able to track your progress as you're treating.
Do you know how much that costs by chance?
I don't think they said, but I actually ordered the Lyme Summit. I'll have it on a flash drive, so I'll be able to rewatch that.
Cool.
So,
Maybe add to that a little bit, I think, one of the doctors I'm seeing, just got back from a Lyme conference of some kind not too long ago. And he's using the iSpot now to follow up the progress of the treatment, not to diagnose it,
Ah.
because of how it works differently. And I think it's about $370, if I remember what he told me, but don't quote me on that. I think that's about what it is. He also added at the conference, he's already been leaning this way, he will not do an IGeneX test anymore without provoking first, because it's still missing up to 25% of the cases, so he's got several methods of doing that, but he will not do that anymore without that first, because it increases the positive results on the test.
and I can add to that on when I had my original Lyme doctor who ordered the IGeneX test, she gave me the option whether to have it or not, and because I had already been on the antibiotic, she said I had the best chance of it showing positive if it really was, and that was only 50%.
Wow.
Best.
Mine did the same, they wanted me to provoke it about 2 weeks ahead of time,
Yeah.
and I did.
Do you all
And still at
understand what that
that's
means?
only a 50-50
To provoke it
chance.
means like to take an antimicrobial, kill some pathogens, now they're floating around, and the test can pick it up.
Mhm.
I did the same thing, you know, I was positive on the IGeneX, but my doctor said you're not positive enough to qualify for insurance reimbursement. Because she wanted to put me on a PIP line, because I'm so positive, and so she provoked it, she said, you know, take this ivermectin for antiparasitic, you know, keep taking your antimicrobials and take some minocycline. And I did that for a few months, and I got tested with the iSpot. And the iSpot was the positive she was looking for. So we put it through the insurance, and they said no, we put it through another insurance, and they still said no. So I still can't get a PIP line, and I've had it since 1989.